afternoon. It's great to be in Highlands County. I want to thank Scott Kerouac, County Commission Chair, Randy Vosberg, County Administrator, and then is Nick here from the City of Venice? I don't think I saw him. But we want to thank everyone for being here. We're excited to be able to announce today, and they're already ripping through this, an additional surge of vaccine here in Highlands County, an additional 3,600 doses on top of what they're already doing. How many have you gone through today, were you telling me?
About 1,300.
So they've already done 1,300. It's only noon. So I told them at that pace we need to do even more. So I think we're going to send even more, which is very good. And part of the reason we wanted to do that is if you look, Highlands County has about 37% of the seniors that have received at least one shot. Statewide, we're well over 50% of all of our seniors have received at least one dose. And we have some counties, St. John's, for example, in Northeast Florida, 80% of the seniors have gotten a dose. Even big counties like Palm Beach is 65%, Broward, Duval over 60. So we really feel that surging vaccine to Highlands, that we'll go from 37% of seniors to probably 50 or 60%, maybe within days even, if we're doing this many thousands. So I want to thank them for their effort. This is one thing we're doing, but we're also going to do on top of that a rural surge program, not just for Highlands, but for Glades, Levy County, Putnam, Dixie, and Gilchrist counties. So if you look at all those counties, Glades is the lowest in the state at 29% of seniors. Highlands is close to the bottom at 37, Dixie 38, Gilchrist 39, Levy 40, Putnam 40. So again, our state is way above 50% of seniors. But I think the good thing about the rural, if you get the doses in and you get the seniors signed up, you can double those numbers very quickly. So what we're going to do is we're going to partner with Health Hero. So this is a provider that the state has used in the past for immunization campaigns. And the goal is going to be those rural counties where the senior coverage is less than the state average. What they're going to do is increase resources to any existing pod. See, I've been working with Representative Tuck about bringing more vaccine to Highlands. So we initially looked into setting up a site somewhere, either at a community center, a senior community, something like that. And then the folks here is like, no, just surge more to R5. We've got a lot of capacity, and I think that was the right decision because they're able to do thousands of people a day through here, which is great. And so the Health Hero, they're going to do things if they want to surge to existing, which I think is what we'll do here. We do pods at churches, we do pods at schools, at senior community centers, all over. Whatever works, we'll do, and I think they're going to try to do it. So what they're going to try to do, in addition to what we're surging to Highlands, is do another 500 vaccine doses on top of that per day, which is really, really good. So I think that this is a good program to do the rural outreach. You know, it's interesting. Some rural counties have done very, very well. Lafayette, for example, they're actually #1 in the state in senior coverage. I think it's like 82%. So I think you can get there, and I think that's one of the good things with, if you have a little bit less population, you get that vaccine in there, those numbers really change very quickly. And the fact that they're already doing this many here today, and you're probably going to, at this pace, do 2,500 maybe even more than that. So what I said was, like, we thought you would do like 1,200 extra a day. It looks like they're going to do more. So we're going to try to work with more of that coming. So we've got Highlands is vaccinated as of this morning, 13,600 seniors. Probably more than that because the reporting lags by probably 3 or 4 to 5 days. But nevertheless, the most recent report, 37%. I think after today, they're going to be well over 40. And then with the surge we're doing and the rural program, we should get Highlands well over 50% of seniors very, very soon. And so we're going to keep working until we're able to do that. And so this is the rural program. It's kind of yet another instance of us working to do whatever we can to get more vaccines to our senior citizens. We've done, last week I was at Edward Waters College in Jacksonville announcing a number of vaccination sites at underserved areas. And so we've started in Pahokee in Palm Beach County. We did Edward Waters, now FAMU in Leon, Kissimmee Community in Osceola, Broward College in Broward County, Oak Grove Park, and Overton Youth Center in Miami-Dade. So those are additional ways for us to get vaccine. And we also have an expansion of the pharmacy program. We had Publix was the main provider. Then the federal government turned on their pharmacy program. So now statewide, we have 12 Walgreens, 81 CVS's, 730 Publix pharmacies throughout Florida, 119 Walmart and Sam's Club, 43 Winn-Dixies. And so that's 52 different counties that have some type of retail pharmacy footprint. In Highlands County, we have 3 Publix pharmacies that are offering vaccinations for seniors. We have 2 Walmarts, and we have 1 Winn-Dixie. And so the Publix window will open tomorrow at 7 a.m. And if you want to make an appointment there, you go to publix.com/COVID vaccine. If you want to go to Walmart, you go to walmart.com/COVID vaccine. And then Winn-Dixie, you go to winn-dixie.com/pharmacy/COVID vaccine. Let's say one thing about the pharmacies. We've seen it really in 2 different areas. When we went into Palm Beach County with Publix, we had 65 Publix pharmacies there. 90% of the seniors live within a mile and a half of at least one of the Publix. And what we saw was Palm Beach was below the state average. Now they're in the mid-60s, which is above the state average, because you have all these pharmacies in people's neighborhoods. They can do 50, 100 a day in each store. The other way we've seen it with a big increase, and it's really good, is Miami-Dade County, very big county. We put in over 60 CVS and Navarro pharmacies, and now they're above the state average, and I think they're going to end up above 60% very quickly, because each one of those stores is doing between 100 and 200 shots, and those are in corners and different parts of every nook and cranny in the community. So I think the retail pharmacy has been very effective. We're working with CVS to expand it even more with them, and I think we'll have an announcement on that very, very soon. We've also continued to partner with faith-based communities. We've done dozens and dozens and dozens of faith-based events, tens of thousands of vaccinations, mostly with African American churches, but we've also done synagogues. We've also done Catholic churches, and it's been very, very successful. We're going to continue doing that. We have a number of them teed up for this weekend. The state of Florida has 87 permanent vaccination sites. This is one of them here in Highlands County. Obviously, you have at least one in every 67 counties throughout the state of Florida. We've also gone into 25 senior communities and vaccinated seniors living in those 55 and up communities. It's been very, very successful. Seniors love it. A lot of times they can just come on their golf cart, get the shot, and then go back to their house. And we're continuing to do the program for homebound seniors. So we've done over 1,400. We did one of the seniors in Charlotte County was one of our first on that. We've done some World War II veterans. We've done Holocaust survivors. We've done a lot on that, and the seniors really appreciate it. So we're going to continue to do that. And then the state also just had started yesterday 4 federal sites where FEMA is bringing additional vaccine, and that's big kind of the urban areas, Miami, Tampa, Orlando, and Jacksonville. They're offering 3,000 doses per day per site. I think the uptake yesterday was about half of that. Maybe as the word gets out, you'll see more traffic, but still, there's shots going in arms, and we really appreciate any support we can get. And then finally, the Johnson & Johnson vaccine. We're going to get 175,000 doses of the Johnson & Johnson vaccine. Those 4 federal sites do have some Johnson & Johnson. That's apart from our allocation. So we're going to get 175,000 within the next couple days. Hopefully, we'll get it later today or tomorrow, and we're tracking that. What we're going to do on Johnson & Johnson is, not all of it, but we're going to offer that to the 50 and up law enforcement, fire, and teachers and school personnel. Because if you look, 175,000, that's about statewide. We could get all those folks in that age group and give them the shot. And I think if you're in the workforce, to be able to do a 1-dose vaccine, which is Johnson & Johnson, you get the shot and then you move on. I think that's something that could be very effective. So we're working on Johnson & Johnson. We're partnering. We're working with sheriff's departments. We're working with some of the schools to figure out what makes the most sense on that. We will also be offering that as part of some of the normal vaccinations. And we really are kind of waiting to see if you're 75 and you come here and you have a choice between J&J and the other, do you want the Pfizer or the Moderna, or do you want the J&J? And some people want the 2-dose. Some people want the 1 dose. So we're just going to have to figure out and make sure the J&J is going to the folks who want it the most. But I do think as we start to get below 65, which we will soon for the general population, anyone in the workforce, that Johnson & Johnson's a great thing, because you go, you get it, and then you can just move on. And then if we're doing any type of events where we're taking vaccine to a community, right now when we do if we're at a church, we got to come back in 3 weeks or 4 weeks, which is fine. We're happy to do it. But just think of how much more you can do if you show up, you vaccinate a bunch of people, you move on to the next community. You don't have to worry about going back for the 2nd dose. So we're not getting any additional J&J for another 2 more weeks. So it's 175,000 over the next 2 weeks total. And then I think they're going to ramp up production now that they have the emergency use authorization finalized. So all in all, I think that there's a lot of great signs with the vaccines becoming even more available. As I've said, we've done millions of senior citizens. I mean, we really believe in putting seniors first. We think a lot of states have followed what we've done. And we have a very large state land-wise, and then we've got a huge population. And all the seniors, as most people know, it's not like they're all in Boca Raton. I mean, they're all over Florida. So it makes it logistically, you got to get out, you got to get in any community you can, and that's what we're doing, and that's why we're here today. And I look forward to them. I mean, this is really impressive. We have some big sites across the state. I don't know that they put up these types of numbers where you're already doing this many people by noon. So I think this is really exciting, and we want to continue to support it in any way that we can. And with that, we'll take some questions. Well, so my order was 50 and up for teachers and any school personnel, any fire, any police. What the federal government has done is said anybody that works in the school system, regardless of age. So they're able to go in these federal pharmacy sites and the federal site. You're 22 and you're a teacher, you can go get it. Now, we're going to focus prioritizing seniors, because the fact of the matter is 95.7% of all COVID-related mortality is age 50 and up, and 82% is 65 and up. So I'm not opposed to someone 20, 22 getting a vaccine, but if we want to save lives, we need to get all the seniors. And so that's going to be our priority. That said, the federal government issued that directive, so if you go to CVS.com, they're going to sign you up if you want to, if you show that you work in the school system, and you'll be able to do it. But our pods and the things when we're surging, we are targeting the seniors still. We've had a lot of great stuff. I mean, we're well over 50% of seniors. We've done millions. We're going to have, we're doing a lot this week. We're going to probably average 80,000 initial doses a day for Monday through Friday, which would be great, and we're still doing 2nd doses. But man, we still got more work to do in the seniors. And then what we'll do from there is we'll lower the age. So once we get a critical mass of seniors, the demand starts to go down, we'll lower the age, and then we'll get the folks who are 60 and maybe 55 and get them up. But I don't want to do that and then swamp out some of the seniors that are still trying to get the vaccine, because the fact of the matter is, through most of December and January, we were getting 250, 260,000 initial doses a week. Well, our state has 4.5 million seniors, and so we were getting some stuff done. Now we're getting more. We're 350, 400, 420,000 doses a week. And so you're seeing that progress. And I think if we just continue on that mission, get those seniors, I think we need at least 65% of seniors, and I think we can get there. Not every senior wants it. That's fine. We're not going to force it on anybody. But I do think that if we can get there, then you're in such a great position going forward. Well, I think it depends. I think that what they've managed to do here using this setup, I think is very efficient and very effective. And we've had some other ones in some other areas where they're drive-through that did do 1,000 to 2,000 a day. The ones that were in the FEMA sites in the urban areas, they didn't have long lines. I mean, the demand was not what I think people thought. They did about half the doses that they had allocated for the day. Now, they're not really signing people up online like a lot of this is. They're actually just picking certain communities. They're knocking on doors. They're asking people to come get vaccinated. And so it's a little bit different approach. I'm totally fine with it because we do a bunch of different approaches depending on our venues. But I got to say, I mean, when we brought the vaccine here today, I was not anticipating hearing that they had gone through that many, and I think they got a really good setup. So we're going to do the 3,600. I'm going to try to get more, and then we're also going to do the rural outreach program. So I think Highlands is going to be in good shape. So hopefully, a week from now, we're looking at 50, 60% of seniors in Highlands, and we'll take Highlands hopefully from one of the bottom to one of the top. It's a lot easier to do that very quickly with the population being a little smaller. When you're in Miami or some of those places, you can make progress, but it just takes a lot longer because Miami's got 467,000 seniors. All right, well, thanks everybody.